So great to meet you, and thank you for having me here. So, in terms of what we do, we are Elara Technologies, which is ranked amongst the top 50 of India's great places to work. And we broadly run two businesses. So, one is the advertising business uh, through housing.com and makan.com. So, both housing and Makan are marketplaces where developers, brokers, and owners can come and advertise their properties. So we work across the buy segment, which comprises new projects, resale, and rental segment as well. So we are the largest demand aggregators in the country. And recently we overtook both 99 acres as well as Magic Bricks on the housing.com side. So if I add the audience on Housing, Makan, and PropTiger, then we outstrip competition. And the number two player in the market, 99 acres, is a distant second behind us. Uh, we have also launched a product called Housing Edge, where the endeavor is to bring adjacent services associated with home buying and home renting online. Because as you know, the market is moving largely digital, and so we believe that these services are likely to come online. So some of these services include uh, products such as Parent, and we were, I think, the first in the market to launch this product. Parent, uh, online tenant agreements, uh, uh, tenant verification, home interiors, home loans, property management. And over time, we'll be adding in products such as legal services so that consumers can not only transact but also take care of these adjacent services and execute them digitally. We also run a business called PropTiger, which is a brokerage business. And PropTiger is one of the best known channel partners in India. We largely work with tier A developers such as Shapoorji, Godrej, Puravankara, Brigade Group, etc. And we are one of the very few players in the world which does both offline as well as online. So normally there are real estate companies that focus online. So if you look at countries in the US, so you find companies such as, for example, Zillow, Trulia, Realtor.com, or you have companies which focus offline, where you have the Coldwell Bankers of the world and companies such as Redfin, Compass, etc. So we are one of the very, very few companies in the world which has the capability to do both online as well as offline. And that gives us a very, very unique capability set in the real estate space, because we look at the transaction end to end from the time the buyer is looking to buy a property till the buyer completes purchase of the property, as well as some of the post-sale activities such as looking for home interiors, etc.
Thank you, Mr. Rangarajan, for the introduction to housing.com and the online platform. This interview will be based on the report that you have got out on the healthcare sector in India. Hello and welcome to another episode of HCR Podcast. Leading online real estate platform housing.com has recently unveiled an exclusive report titled State of Healthcare in India, Indian Cities Through the Lens of Healthcare, amid the biggest health crisis due to COVID-19. The report highlights the global picture of healthcare, daunting India's story, and the city-wide health cards. These rankings are benchmarked against the parameters such as number of hospital beds, air quality, water quality, sanitation, livability index, etc. Today we have with us Mani Rangarajan, COO, Housing.com, Makan.com, and PropTiger.com to give us an insight into this report. So let's begin with the very pertinent question. Where does India stand in its healthcare spending?
I'm really glad that we are finally starting to focus on healthcare. And I don't think healthcare would have received this focus without something like the pandemic, which is ongoing right now. So over the years, healthcare has really taken a backseat in India. There have been successive governments, and there have been like national health surveys, which have aspired to look at India's healthcare spending. Till 2020-21, India was barely spending about 1.6% of the GDP. So if you look at countries, for example, such as the US, where almost 17% of the GDP is spent on healthcare, and when you look at countries such as Japan, Germany, France, they're all in the ballpark of about 10 to 12%. Even if you compare the BRICS nations, so you look at Brazil, for example, they spend close to about 10% of their GDP on healthcare, and China is at about 5%. Now, in the last budget that was presented in February 2021, the government introduced almost a 140% increase in healthcare to about 3.5% of GDP, which is still minuscule compared to the standards set by the other countries. So we have a lot of catch up to do in terms of healthcare spend. And we are quite fortunate in that our population is not so aging. So when you look at the percentage of population about 65 years, and you look at a country like Japan, it's at about 28%. And if you look at countries such as the US or Germany, about 20% of the population is about 65 years. We are fortunate in that we have a very young population, and we have about 6% of the population which is at about 65 years. However, even in terms of life expectancy, we average about 70 years compared to countries such as US, Germany, France, and Japan, which are north of 80. And even China is almost close to 80 years. So we have a massive problem on our hands because by 2040, we are likely to have a huge portion of the population which will then start to age. And so we really have to focus at this time to look at the healthcare structure, the infrastructure, and the way it's administered across the country.
The report, City Health Card Report, which states about the state of healthcare in India through the lens of healthcare structure. Could you share light on this report to our audience?
So this is part of a housing research group, and we usually release very topical results research into healthcare. And one of the things that we found pretty recently was that the population which is interested in buying a home is very, very interested in healthcare. So in fact, healthcare ranks amongst the top parameters right now in terms of people looking for homes. In the sense, people are looking for healthcare facilities close to the homes that they aspire to buy. And the other two important things that people are looking for is in terms of open spaces, and the other thing is daycare facilities. So what we have done here is we have largely focused on the tier one cities. Now, when you look at India's population and the way it's distributed and the way the healthcare is distributed in India, so 50% of the population has access to about 65% of beds, and the remaining 50% of population has about 35% of the beds. And about 70% of hospital beds are largely available in tier one cities, which is why we saw a crisis in cities such as Delhi, because people from neighboring the tier two and tier three, which are the smaller cities, and the neighboring states, tried to go to Delhi to receive healthcare there. And so what we have broadly done in this report is that we have taken these top 8 cities. We have looked at the number of hospital beds per 1,000 population. And we have split that up by both the private beds as well as beds available in public hospitals. We have also looked at the rank for these top 8 cities across various different parameters. So for example, we have looked at Indian cities from uh, a perspective of the number of hospital beds, air quality, water quality and availability, sanitation and solid waste management, ease of living index, the municipal performance index, as well as sustainable initiatives. And so we have arrived at a ranking of the top 8 cities. So Pune ranks amongst the top cities, amongst the top 8 cities that we've seen, uh, for the reason that it has a pretty solid healthcare facility in terms of the number of hospital beds, there's solid water quality and availability, great sanitation and solid waste management, good ease of living, and a good municipal performance index, as well as sustainable initiatives. And the last ranked city is Delhi NCR, uh, largely for the healthcare infrastructure, which is largely centered around Delhi, poor air quality, uh, poor water quality and availability, and municipal performance index.
The pandemic has exposed the state of healthcare in India, and we are the third largest economy in Asia. So it has also showed that how we significantly need to increase its spending on healthcare. So do you have what, in your opinion, are the steps necessary to cut down this deficit that we have in terms of healthcare infrastructure?
There are several ills that ail the Indian healthcare system, right? And let me talk about it briefly. So there are challenges with the structure of healthcare system. There are challenges with the infrastructure availability, and also there are challenges in terms of people who are going to administer healthcare, right? So when you look at India's healthcare model, it's a combination of public and private health insurance, along with the element of almost entirely tax-funded public hospitals. So first of all, when you look at insurance coverage, so it is at various levels. So you have the government introduced schemes called Ayushman Bharat, which is for enterprises having less than 10 employees and offering free treatment at both public and private hospitals. And it has, I think it has an insurance cover of about 5 lakhs. And then you have, and Ayushman Bharat is expected to cover about 50 crore people. The second is we have the employee state insurance. And then you have health insurance coverage, which employers provide and people take through public as well as private insurance companies. So first of all, when you look at the number of Indians that are covered by insurance, even if you take into account Ayushman Bharat, less than 50% of the population is covered by healthcare insurance. So one, that is a large issue, and the government needs to find ways and means, including administering like insurance policies digitally, to expand insurance coverage to a greater proportion of the population. The second is that when you look at the way healthcare is administered and the number of hospital beds available, so even including the number of private beds which are available in India, it's pretty limited, right? So when you look at the average number of beds available per 1,000 of the population, right? You're looking at something like about 0.5, which is very, very low, right? And the globally expected standard is somewhere between 3 to 3.5, right? And about 70% of this is available only in the urban areas, right? So as I said earlier, there's a whole issue in terms of the distribution of health infrastructure. The second is when you look at the number of doctors per 1,000 of the population, that's again at about 0.9. And if you compare it with that of the United States, which is at about 2.6, again, we are pretty low. Now, if you take into account the 0.5 hospital beds per 1,000 population, we are looking at a shortfall of about 3.5 million hospital beds, right? And by 2030 or 2035, we are actually looking at this number to double. So if you take into account both public as well as private hospitals, the shortfall comes down to about 2.5 million, which is still a very, very large number. So that's one problem, number one, in terms of the sheer infrastructure which is available. So that's one. The second, as I said, is in terms of healthcare providers, where the number of doctors per thousand of the population, as I said, is less than one compared to 2.5 in countries such as the US. And we are also facing a shortage of nursing staff as well, right? So we need to have a number of trained doctors, increase the number of trained doctors in India, right? And the number of nurses which are available, right? So that is one on the infrastructure side. The second is that in India, healthcare is a state subject. And in my opinion, healthcare is very, very important. And so we need to look at healthcare at least in terms of as a concurrent subject. Right? So when you look at healthcare, there are three things which become important. So first of all, one is access, which is the ability to receive services. The second is the utilization of healthcare. And the third is attainment. Now, in terms of access, we have a huge problem because healthcare coverage is pretty sparse, particularly in the rural areas. The second, when it comes to utilization, again, a lot of it is in the hands of the private healthcare providers. Now, there is nothing wrong in terms of a country leaning on the private sector to provide healthcare. But again, here there are issues around the treatment protocols as well as the cost of treatment. And one has heard several stories where private healthcare providers seem to have fleeced patients whom they are treating, right? So that's the other issue. Added to this, the out-of-pocket spend, right, is at about 65%, right, which is very, very high. So when you take countries such as US, the out-of-pocket spend is very, very low. But here with a 65% out-of-pocket spend, that's pretty bad, right? So the government needs to kind of work with the private sector. There needs to be a public-private partnerships, and the government needs to set up standards for treatment as well as the cost associated with treatment. Let's also keep in mind that India, the population is going to be fairly aged in 2030, 2035. As I mentioned, the number of people over 60 will be growing. The Indian population is also vulnerable to a lot of comorbidities. So about 21 in every 4 Indians has hypertension or associated health problems. So the focus does not only need to be on treating people, but also on preventive healthcare. So that's another issue that we face in India. The third is in terms of the cross-learning between states and the curation of best practices, right? So we need a cooperative, federal system handling health response to pandemics, which is a joint responsibility of the center, the state, the local governments, as well as citizens. So during the onset of the pandemic, right, and especially during the second wave of the pandemic, there was very little information sharing across the states. There was a lot of incomplete information, which resulted in the proliferation of faulty analysis and conclusions and treatment protocols which were not standardized, which did not really inspire confidence, but instead induced panic. So India needs to invest in a resilient information infrastructure where people across states, the various state governments, and the center can work together and see relevant and scientific information being shared on a regular basis. The third thing which we need to do, encourage investments in tier 2 cities and tier 3 locations and beyond metropolitan cities, right? So there's like, India has a very massive healthcare segment in terms of the opportunity size. So that one is looking at a healthcare segment of about 360 to 370 billion dollars, and there's at least about 30 billion dollars in terms of investment opportunities in the country's hospital and medical infrastructure subsector. The government is doing its bit by encouraging, foreign direct investment and removing limits on foreign direct investment in areas such as in insurance, where foreign investor can invest to up to 74%. But there are a lot more things that we can do to encourage private players to move to tier 2 and tier 3 locations. And things are improving as we speak. We also need to kind of focus on telemedicine and home healthcare. And one needs to take advantage of the digitization opportunities in India and the acceleration of digitization over the last couple of years. Home healthcare is unique because not only care is provided at home, and it's less expensive, it's more convenient, and it can just be as effective as a care given in a hospital or a skilled nursing facility, right? So when you look at home healthcare, you can save about 15 to 30% costs in terms of treatment compared to hospitals, and it can replace about 60% of unnecessary hospital visits in India. So the government needs to work on a public-private partnership and expand the use of technology and focus on telehealth and home healthcare. And lastly, healthcare is, as I mentioned, we need to focus on preventive healthcare as well. And we need to focus on creating more health wellness centers across the country. So right now we only have about 60,000 centers. And so the need of the hour is to expand that and build more health wellness centers across the country. So in broad terms, right, so there is an issue with the whole structure, the infrastructure and information technology structure that we in the Indian healthcare system. And we need to really focus on this, and through collaboration, engagement, partnership, knowledge, and skill sharing between the state government, the central government, and the private companies in the healthcare sector. We need to really focus on that to improve the state of healthcare.
You touched upon the public healthcare system and the private healthcare system, the parity which is there in both the systems. Plus, you also talked about the reaching out to tier 2 cities. So, how do you compare the quality of healthcare infrastructure when it comes to urban and rural areas? Because now the population in rural area is also going up thanks to pandemic, because most of the reverse migration happened. So how would you compare the quality of healthcare structures which are available right now there?
So the quality of healthcare which is available in the rural areas is simply not up to the mark, right? One, as I said, the hospital beds is pretty lopsided in favor of tier 1 cities as compared to like tier 2 and tier 3 cities. The second is also that when you look at the number of doctors who are available in the tier 2 and tier 3 cities, it's pretty low. Right? So 70 to 75% of the doctors are in urban areas, right? And so there's a major issue for rural access to healthcare, right? So consequently, when you look at the shortage of medical professionals, as well as the shortage of nursing care, and the shortage of infrastructure, which means we are talking about medical devices, CT scan machines, and other sophisticated medical infrastructure. It's pretty insufficient in tier 2, tier 3 cities, which are lacking in supplies. Right. The level of immunity in rural communities is also pretty low, right? So the full immunization coverage is just about 40% in rural communities compared to about 60% in urban areas across India. So obviously, the healthcare system is lacking on multiple fronts in rural areas, which is why, in crisis situations such as pandemic, people tend to flock to the urban areas to get the treatments done, and that adds a lot of pressure on the tier one cities, both in terms of the ability to support people who are coming into tier one cities for getting healthcare treatment, and ultimately, it's not a win-win situation for everyone.
If 2020 has taught us anything, it is about the futility of forecasting. So, how do you personally approach forecasting in an environment like this for the real estate and the healthcare sector?
When we looked at the housing healthcare index, right, we're very careful in terms of how we have constructed the index. So there's very little forecasting that we did in terms of coming up with the city healthcare methodology. One is we assign like weighted scores for parameters like the number of beds, air quality, water quality, sanitation, and waste management. Only considered hospitals with more than 100 beds because we wanted to make sure about the quality of information. And data available for each hospital was taken either from government sources or from hospital websites. Air quality was assessed through the AQI for every city. Water quality through the Water Stress Index and the Bureau of Indian Standards. Sanitation and waste management we assessed as per the Swachh Sarvekshan ranking of 2019. And the population of each city we projected using the census of India in 2011, right? So our idea is not really to arrive at a focus, but a forecast of the numbers for healthcare. But our idea was more to bring the lack of healthcare infrastructure, even in top 8 cities, to the attention of everybody across the country. And as I said, right, healthcare is now being taken viewed seriously by a lot of the potential home buyers. And as I said, it's one of the top ranking indicators that home buyers are looking for when it comes to healthcare. So home buying, one of the top points that home buyers.
There is one last question that I would like to ask. This is regarding the building resilient structures. So there are many unused infrastructure available across the nation in terms of rural and urban areas. So how would you count it as, if you can reuse these old structures into healthcare infrastructure? What's your opinion on that?
Definitely, there's a lot of merit in what you're saying. I think, in a country with India's population size, so we're talking about around 140 crore people, and by 2028, 2030, we're likely to be the most populous country in the world. We don't have too many choices. The government did a great job by increasing the healthcare spend as a percentage of GDP in the budget, right? In fact, I would say the government went beyond its means to increase the spending. But as a country, we really need to be very smart and developing healthcare infrastructure and leverage technology to the fullest in terms of providing healthcare facilities and resuscitating as you said, the unused facilities. So recently, I think I read somewhere that in Bangalore, they managed to restore an unused facility within a period of 7 working days. So we all need to focus on initiatives such as this in order to drive healthcare infrastructure.
Thank you, Mr. Rangarajan, for your time and the detailed insights about the report on state of healthcare in India.